What are signs of autism to aid early diagnosis? Have you ever wondered how to spot the signs of autism spectrum disorder in children? Recognizing these signs early can make a big difference in getting the right support. Autism spectrum disorder is a developmental condition that usually shows up in early childhood. The signs can vary widely, but they often involve differences in social communication, behavior, and sensory responses. For babies, around 6 months to 1 year old, some early signs to watch for include limited or no eye contact. You might notice they rarely smile in social situations or do not respond when their name is called. They may have difficulty following objects with their eyes or show unusual reactions to sounds, either overreacting or not responding at all. Limited babbling or imitating sounds can also be a sign, along with a lack of typical gestures like pointing or waving. Some babies may show repetitive body movements and might not reach out to be picked up or cuddled as expected. As children grow into toddlers up to 24 months, the signs can change. You might see limited or no speech, walking on their toes, or difficulty following simple verbal instructions. They may have a limited ability to imitate others' actions and show intense interest in specific objects while ignoring others. Unwillingness to share interests or engage with others can also be common. Repetitive behaviors like lining up toys are often observed during this stage. For young children, additional signs include not responding to their name, avoiding eye contact, and not smiling in response to others. You might notice repetitive movements, such as hand flapping or rocking, and a reduction in pretend play. Children may repeat phrases and struggle to understand others' feelings or social cues. As they grow older, they may show a strong preference for routines and become distressed when those routines change. They might focus intensely on specific subjects and find it challenging to make friends, often taking language very literally. It is also important to note that autism spectrum disorder can present differently in girls. They may mask some signs by imitating peers or withdrawing quietly, which can make diagnosis more challenging. Early identification of these signs is essential. Observing behaviors and consulting with healthcare providers, educators, or special education professionals can lead to timely support. Early diagnosis allows access to tailored educational plans and therapies that help children develop and learn effectively. Special education staff, such as special educational needs coordinators, play a vital role in recognizing these signs and facilitating appropriate assessments and interventions. Understanding these signs within the context of special education helps families and professionals ensure that children with autism spectrum disorder receive the support they need to navigate learning and social environments successfully.